Again, we're going to come in, foot underneath knee. We're going to just do that gentle rocking again. So what this rocking also does is it helps to get the brain to kind of relax around what we've got going on. Sometimes we're so tense, but during this rocking motion, it can help things relax without really having to force it. And what that also does is that gets some really great gentle movement along all of those erector muscles, everything in your lumbar, everything that attaches to your spine. All that stuff is now getting some nice gentle movement while we're doing that rocking. And hold just like that. Get a little bit more movement on this side. So we can go a little bit deeper. How does that feel? Awesome. And then back to the rocking. Again, getting that movement along the spine, along all of those rotatores and multifidi, lots of names for lots of muscles that are in our back. Then I come in and do this, pop up just like that. Now again, Kristen, she's got lots of extra room. Is that okay? Good, right there. She's at her edge, which is great. I'm gonna hang out here. Let her feel that. Let her work around that, and it's all good. Just to add a little bit for her, I'm gonna add a little bit of an arm traction, because again, she's so bendy. Jealously bendy. Jealously, I don't know how to say that word. Enviously. Just pressing in and then relax. So I'm gonna come and do these beautiful broad quad compressions and IT compressions. And the reason why we focus a little bit on quads is because you can see quads are large, they're like half our leg. And what they'll do is they'll pull on our hip and pull them forward, which then stresses out and stretches out all of those wonderful lumbar muscles. So they start getting all upset. Like, guys, calm down. So we got to tell quads to calm down too. So again, I can feel where Kristen's got some tension. And pull back on now my right foot, pressing in more with my left, back and forth. Kind of like a wave motion. Listen to your partner's breathing. On inhale, relax. On exhale, we're gonna push. Just like that. If I find an area that needs extra special attention, I'm gonna take my heel, just press in. Again, I can adjust the pressure down or up. Just, hey, we're here, a little bit of movement, just because I find stuff. Now we have some beautiful movement in Kristen's hips and legs, which is awesome. Now we're gonna go and do our stretches. We've warmed up the hips. Now we're gonna do some more stretches on this side. And again, I'm just holding in. Her femur, her big leg bone, and her hip bone is just a little bit north and a little bit west of where my foot is really, really pressed in. I'm not pressing directly on her hip bone because that feels uncomfortable. Nobody wants a foot jammed into their hip bone. I mean, do you, Kristen? I mean, okay. So she doesn't want it either. So that's one thing that we just have to keep an eye out for is we don't want to find the hip bone and just go bam, or find that hip joint and go bam. Be very gentle. We like our receivers usually, so we want them to feel good. So once we've got those hips all nice and warmed up, we're just going to, again, do some gentle range of motion. Get that synovial, that joint fluid, coating the inside of that hip joint. We're going to bring it over. Take a deep breath in and out. Good job. So sometimes your client or your receiver, you can brace their hip with your leg. This allows for them to have the stretch without having to fight their body for it. I think this camera might work too. I'm going to do this. So now what I'm doing is I'm pushing her down and this way to just help it open up that lower lumbar region, that lower back region, because it can get all squished together. I'm going to brace her hips with my legs. Do this nice low back, full body twist. And really, really get that stretch. How's that feel? Awesome. So then once we've done that, and if your receiver has pain here, you can work here too while they're hanging out. Lots of different things we can do. But what we're going to do now is lift that knee up, put her bottom back onto now my left knee, bring it up and over, and open up those hips. How does that feel? This side is definitely tighter. So I love Kristen's leg. I'm going to bring it with me wherever I go as I do this range of motion. Such a beautiful leg. Thank you for letting me have it. And because Kristen is so bendy, again, foot across, and just lean back and hold. How's that feel? Okay. Once we do that, I'm going to bring her up and over. Set your partner down. You don't want to drop their legs. Usually, again, we like our receivers. I'm going to be nice and gentle with that. Another very easy thing to do is grab your receiver underneath their ankles and lift up. How does that feel in your knees? Is that okay? Good. So super great, easy on the knees. We're going to just gently traction that low back on the knees, just like this. Just gentle traction. How's that? And then just for good measure, you could bend your knees for me. Bring up. Okay. And I'm going to bring your knees to your chest. Then cross. We're going to cross just like that. You see, knees on the other side. I like to put my feet right up to their bottom. And just gently press in. How does that feel? So what this is a nice low back stretch, releasing all of that tension in those lumbar muscles, everything along the spine, everything along the glutes, SI joint. Great finish. And with that, and that's it. How do you feel?
Good.
Awesome.